Hi, I'm Dr. Larry Beutler. I'm a professor here at Palo Alto University, and my area of particular interest is in psychotherapy with a secondary interest in mass trauma. Our research group, in fact, combines those two themes, meaning that students work on one of those areas or another. To come into our group, students in their second year and sometimes in their first year make an application to join us. They can spend two different sessions in with us in our research group, and then they take on a project helping another student develop a research program, so they get an idea of what's going on in the area that they're interested in, either some aspect of psychotherapy or some aspect of mass trauma. Let me give you a few ideas about the kinds of things that we've been studying. Recently in the psychotherapy area, we've been applying concepts of treatment matching to different kinds of patients, not diagnostic groups, but different patient personalities, and applying that to Asian countries and South American countries as well as the United States. We've also been looking at the concept of mass trauma, civil trauma, and terrorism, and the differences among those in terms of how they affect people and how people are treated. One aspect of those studies, for example, has been on looking at the way people perceive their risk of being impacted in their life by a mass trauma of a civilian nature or a military nature, a terrorist event, and then rating, in fact, how it might affect them based upon how they perceive it. Students in the research group cover the gamut. They are expected over the course of their time with us to get involved in several research projects at several different levels. So they help other students gather data, they help other students interview patients if that's necessary, they help students analyze data, and they help write the papers that are then published. Students ordinarily publish 2 or 3 papers over the course of their time with us before they get their dissertation. So that kind of prepares them for a dissertation, prepares them for undertaking the tasks of the dissertation, and even helps them select dissertation topics. Finally, frequently they can utilize some of the data that we are gathering on other projects to employ in their own research and dissertation studies. There's a number of examples of that, but we have students that have looked at the impact of the relationship in psychotherapy, the impact of different matching variables between treatment and patient type in psychotherapy, the risk factors associated with mass trauma, as I mentioned a few moments ago, and even analyzing some of the data that we gathered from Hurricane Katrina in trying to identify what the response level was of FEMA and various other governmental groups. So we'd be pleased to have you take a look, talk to one of our students, come talk to me, and see if our interests coincide.